Hi, I'm Laura Horn. I am the lead Practice Learning Facilitator here at NLAG. My main role within T-levels is to support the students right from meeting them all the way through to the very end of their placement with us. As a trust, we wanted to be involved with T-levels because we wanted to be able to grow our own local homegrown talent, being able to feed into the local universities such as Hull and Lincoln. We've been able to successfully do this as well. But also personally, I wanted a new project to focus on as well. So my first involvement with T-levels started a few years ago now, where we had a meet and greet over at Grimsby College, just as a start off, just to find out a little bit about T-levels. I had no idea what T-levels were before. I'd only specifically supported our degree level students. Within my role, I've previously looked after student nurses, student midwives, student paramedics, and that was my bread and butter. So taking on something completely new was really out of my comfort zone. So I decided to just grasp this and see where it went. I really didn't think we would be where we are today, now supporting 6 different colleges across the whole trust, which is absolutely phenomenal. We started out where we just picked a couple of placements and then fitted students into that. And we quickly realised that just didn't work for us. So what we did was we've adapted this over time, and we've learned from our challenges, and then we've adapted it to be what it is now, where we now have 2 different types of programs. We have the health programs for those students who are looking to be doctors, nurses, and also midwives, paramedics, AHPs, including physios, pharmacists as well. We're able to support all of those students. So by listening to the students and finding out where they are best suited, we then are able to place them in those specific areas. So then we have that side of things. We also have the phenomenal GRACE project, which is known nationally now, which is named after a student who is now a student midwife and has gone through the full programme. The T-levels has benefited our trust in so many ways, starting out from being able to realise that we can expand our placement capacity. When we look at what we can offer to students such as student nurses and student midwives, that's great. They need to be supported by a registered healthcare professional. These T-level students are able to be supported by all the members of the staff within our trust, meaning that we can utilise our healthcare support workers and make them feel really valued in supporting a student in their journey towards their career pathway, which may actually be to be able to do their job one day. So T-levels is also supported within our workforce as well, whereby recently we've been able to have 80% of students from the T-level programs from one of our local colleges are now recruited and work within NLAG, which is fantastic. So we are keeping that local homegrown talent right where we want it within NLAG. It's also been great to see some of our T-level students stay within the area, so they have followed on that career journey whereby they have gone to our local university. So for example, Grace, who, as you know, the GRACE project is actually named after Grace, our first ever student onto the GRACE project. She is now a first year student midwife at Hull University, which is fantastic to see. So we're able to see Grace progress through her journey to becoming a midwife. Additionally, many other students that have gone through the T-levels in our local colleges are now returning back to us as programs as student nurses and student paramedics, which is also great to see. We make sure all of our T-level learners have a mentor within the trust, meaning that they have somebody to go to regarding their shifts, if they want to do any additional hours, for being able to meet them outside on that very first day and showing them around, to helping and supporting them with any of their learning outcomes that they need to achieve with us. That means that they have got that go-to person to be able to support them, whereas they have myself and my team too, but they actually have somebody on that ward or in that clinical area to support them. We have fostered some great relationships with our local colleges. It started out, our first ever T-level students were from Grimsby Institute. And if it wasn't for Tia over at Grimsby Institute, I really don't think we would be where we are today without her support and her motivation to have her students on placements with us. This has then enabled us to take what we have learned from our relationship with Grimsby Institute and then expand that to working with other colleges, and even expand that even further to areas that we probably wouldn't have reached before. They also keep us updated with when ideally they would like their students out on placements with us too. They also inform us of when they would like us to come in and do inductions with students, and keep us updated with any dates, and make sure my diary is always full of arrangements and appointments to meet students, to meet with them when our lives are very busy as well in our other roles that we do within the Trust. As a trust, managing expectations has been the greatest challenge for us. An example of this is we had one learner who was absolutely passionate about becoming a paramedic, and he really saw himself having a placement within A&E. On further reflection of this, when we interviewed this student, we really didn't feel he was ready for the A&E environment, and we felt he needed further development on his communication with other staff. So what we did was we placed this learner in a really small team where they were able to nurture him to his full potential. They did exactly what we expected and nurtured him to the point where he absolutely thrived and loved it there. You would regularly see him with other members of staff in team photos as part of that team. He really was a member of that team. Now we look at this student and he is in A&E, he's thriving in there too. And when you ask him, was this the best decision to not give him A&E straight away? He would tell you yes, he wasn't ready back then, whereas now he is. His passion is still absolutely to become a paramedic, and we have just helped that little bit extra to support him with that. It would be easy to say that the greatest achievement for the Trust would be the Grace Project, due to how well it has been received by both Trust, colleges and students. But personally, I feel being able to be recognised as the lead for T-levels is a great achievement for myself and also for my wider team to have that great involvement. To have other colleges, other trusts come to us and ask us for guidance. I really never thought we would be those people, but we are. It's really difficult to talk about your achievements sometimes as somebody who likes to let other people take the credit, but I really am proud of where I have got T-levels to, starting out with one college with 4 little placements, ranging up to 60 placements now across 6 colleges. It truly is phenomenal to say that we've been able to do that. With regards to positive feedback, we hear plenty of this, not only from our staff, but from our students as well. Staff are always commenting on how switched on these students are. For young minds, they are so passionate about learning and wanting to always be doing something. These students are never sat down, they're always active, trying to find those learning opportunities, which I really hope that they take through with them towards their careers, whether that be the degree route or the apprenticeship route. Feedback from students is also great to hear. One student has also told me, who is now studying nursing at Hull University, that if it wasn't for me and my guidance and support, she wouldn't be where she is today. And as a healthcare professional, that means so much to hear that kind of feedback. If I could offer any advice to anyone looking at supporting T-level learners in their workplace, I would say absolutely do it. The benefits of taking a T-level student outweighs all of the admin that does come with it, unfortunately. That short-term little bit of admin that you need to do to get set up and supporting those learners, the benefits at the end of it are fantastic. Like us, when you're seeing Grace, that initial student on the Grace Project, thriving as a student midwife, and many of our other students returning as student paramedics and student nurses, it really does show that the work that we have put in, all those hours of meticulously looking at where we can put students, all the meetings with the different colleges, it really does pay off in the end. So absolutely go for it, do it.